there. We have 3 schools here. Now, these are advanced schools. They're part of college programs. They're radiation therapy, the radiation therapist, nuclear medicine technology, and radiologic technology, x-ray techs, which also expanded. Tori was talking about people with ultrasound, CT, MRI, that's all involved with these schools, directly or indirectly. We have some of the people here. This is Nick. He's from radiation therapy. He's graduated.
Today's my last day.
Today's his last day here. So take it away.
Sure. So like Bob was saying, my name is Nick. One of the senior students. There's 6 students here at Freighter. They take somewhere between 4 and 6 every year. Has anyone heard of radiation therapy? Know what it is? Yeah? A few of you. So if you've kind of had any experience with any relatives or anyone dealing with cancer, that's about the only way I imagine you've probably heard of it. So what we do kind of on a regular basis, cancer patients are referred to us. Doctors kind of go through their spiel with them, and radiation therapy is a form of treatment. So they use these machines here. They're called linear accelerators. We lie them on the table, and we set them up to marks that we have given them in a CT simulator, and kind of operate the machinery. So it's kind of a good blend of technology and a lot of patient contact. So it's kind of a good field to be in if you're into those kind of things. It's a 4-year degree. UW-La Crosse is the only one in the state with it right now. I think there's some smaller 2-year programs, but those are going to be kind of going extinct here in the near future. So if you are interested in doing it at all, before you do anything, you have to do 40 hours of observation. That can be at any hospital, cancer clinic, whatever it may be. They just want to make sure that if you're applying for the school, they want you to be interested in it and know that's what you want to do, not so they're just getting applicants and then accepting people and then find out that's not what they want to do. So you do 40 hours of observation, wherever it may be. Your first 2 years at UW-La Crosse are all general education classes, math and sciences for the most part. Of course, you have to take a couple of random gen eds as well, but at the end of your sophomore year, you can apply for the radiation therapy program there. There's kind of an extensive application process, and if they do accept you to the next stage, you do an interview process with the clinical coordinators and the director, and they accept about 20 students every year. If you don't get in your first year, you're more than welcome to apply again. You have to do another 40 hours of observation, unfortunately, but you can apply as many times as you would like. So like I said, they take about 20 students total in the UW-La Crosse program. There's 5 clinical observation sites, Freighter being one of them, and of course the best of them. So here, Madison's got one, Chicago's got a couple, and La Crosse has one as well. So you come here and you spend 13 months here as a part of your senior year. So you spend 3 years in La Crosse, the first 2 general educations, 1 being in the program, taking classes, and then the 4th one is 13 months here, and that's what we're finishing up right now. So this is where you do all your hands-on stuff, kind of learn the job. So pretty great time. And then at the end of all of this, you have to take a national board exam if you want to practice as a radiation therapist. So that's what we're going to be doing starting next week, is a board exam. So it's kind of the lowdown. I have contact information and everything on here. Does anyone have any questions about radiation therapy, about the program itself, anything like that? Yep.
Can you ever go wrong?
Sorry?
Can the treatments ever go wrong?
Yeah, unfortunately, things have happened. Wrong patients have been treated, things like that. Nothing like that here. Of course, you're dealing with radiation, and sometimes it's a lot, and it's dangerous. But that's why there's radiation safety officers. There's a lot of physicists. There's doctors. I mean, the plans are checked and double-checked and triple-checked. The engineers and the physicists, they do QA on the machines daily, monthly, annually, to make sure that doesn't happen. But unfortunately, yeah, it has happened in the past. So right now, I think there's 104 being treated daily, which is a lot. Usually, maybe 70 or something like that. So you probably see, we have 5 machines here. On average, I would say you see about 20 patients a day maybe. Treatments can be anywhere from 10 to 15 minutes all the way up until 45 minutes or so. The patients come in once a day for 5 days during the week, and sometimes they only have 5 treatments, sometimes they have 40 treatments. So you get to know the patients pretty well. Yep.
Where do you guys get your radiation and how much does it cost you guys?
So the radiation comes from this linear accelerator machine. There's kind of a lot of physics behind it.
It's a high-powered X-ray.
Yeah, it's exactly right. So it's just kind of an X-ray, and then this accelerates it into fast-moving particles, basically.
Doesn't it like use uranium or something?
There are brachytherapy sources, which is kind of internal radiation, where they'll put like seeds and different things in. And Nuke Med can talk something about that a little bit, but as far as this goes, it's simply just X-rays that are accelerated. So, yep.
Like, how can something help cancer if it has radiation comes out?
Yeah, you're absolutely right. Radiation in high doses can cause cancer, but we do minimize the amount of radiation we give. There's, again, a lot of physics behind it. And we also, it's very conformal, it's very specified, so there's a lot of blocking and things that they use, lead leaves and things to block the radiation, so you're really only giving dose to the tumor. And then there's a little bit of dose going to other organs, but they really try and centralize that treatment to the tumor and not to any other part of the body. So you're not treating the whole body, you know, with high doses where you would get cancer or something like that. So.
Are there any like jobs available for like making those machines?
I try to think. The main producer, we work with Siemens machines, and I think we're changing to Elekta. But I know Varian is kind of one of the main producers right now, so I don't really know a lot about the making of the machines. I know like engineering, they do a lot of the fixing of the machines here and stuff like that. So you'd probably have to go an engineering route with something like that. You know, you'd probably have some better questions, maybe talk to MSOE or something like that. So, yep.
What's the difference between radiation and chemotherapy?
So chemotherapy is kind of, it's a drug you take, and it could be pill form or you know, topical or injection or something like that. It's systemic, so it treats your whole body. And that's why they get the hair loss and the sickness, and they get a lot of that stuff too. So that's, where radiation again is kind of more conformal, so you're really only treating one part. So they might get side effects if you're treating, you know, if you're treating the bowel, they might get nauseous, or if they're treating the head, they might get hair loss, but it's more to that part where chemotherapy is systemic. Anyone else? Yep.
Is there any types of cancer that can't be, like, you can't have radiation?
Yeah, some radiation treatments work better with some cancers and not so well with others. Some like the soft tissue sarcomas and things like that just are kind of radio resistant. So it's a good question, but yes, it doesn't work for all treatments.
Which kind of therapy would you prefer to use?
You know, again, it depends on the type of cancer and the stage and all that stuff. A lot of patients will get chemotherapy and radiation, or they'll get surgery and radiation or surgery and chemo. So they use kind of a lot of different modalities to treat cancer. Depends a lot on the actual treatment and the cancer that they have. There's going to be pros and cons to both, truthfully. Yep.
Why would you say that a cancer patient should use both or either one, like either chemotherapy or radiation therapy?
Why would you use either one?
Like, which kind of cancer patients do you think, like, which stage should use both?
So they use, chemotherapy helps to make the radiation work better at sometimes. So for some cancers, they'll use that to help make the parts, whatever the tumor is, more sensitive to the radiation, and then they'll be able to treat it a little bit easier. So I think that's kind of part of the reason they use both most of the time. So. Yep, there's gonna be, like I said, a lot of side effects. You know, if you're treating certain parts, if there's, you know, skin folds in the area you're treating or something like that. Some of the patients, you need to give them a high dose to kill some of the tumors and different things, so, skin rashes, you know, ulcers, they get fatigued, you know. There's a lot of different side effects to it, and ulcers are definitely one of them.
And if you come in with that and like you get like therapy for like once, how much does it cost?
You know, I don't really know too much about the pricing. I think it's expensive. I imagine it is, and insurance picks up some of it, but doesn't always pick up all of it, so it is expensive. But we do have, like, there's specified nurses in our department that they see the patients once a week. They see the doctors once a week to make sure, you know, that the treatments are going okay, that we're not mistreating them, that they're not, you know, overdosing them, something like that. So they take a look at all the side effects every single week to make sure that it doesn't go too far. If it starts to get an ulcer, they'll tone it down or take a look at it, so.
Are there other things radiation could be used for?
There are, sometimes for people that get like bone replacements or something like that, the bone will start to grow really quickly and get like bone spurs and stuff, so they'll use radiation for like heterotopic treatments, and all it does is help the bone kind of stay in place. It doesn't start to grow crazily for kind of, you know, replacements and stuff like that. Like I said, if you guys do have questions, that's my email on top, and the bottom one is our educational director, so if you did want to do observation hours or talk to her, if you have any questions, she's great. You know, feel free to let me know or let her know if you guys have any questions, so. If there's nothing else, I think I'm gonna pass it over to these guys. Great questions, guys. Again, let me know if you have anything else. Thank you very much.